noticed that Dad was slumped over in the front of the ski boat, so my sister and I were like, "Dad, what are you doing?" We thought he was playing with the dog. So we pulled him up, and he looked like he was having a seizure. Almost like he was gasping for air, but, you know, his teeth were clenched, and, you know, something was definitely wrong. So then we stormed across as fast as we could from across the lake to the dock here at the lodge.
I heard a blood-curdling scream from what turned out to be Bob Christensen's family. We laid him on his back on the dock, and I began to go through my checklist that I had in the back of my mind from teaching CPR so many times. I remember doing a couple sets of breaths and compressions, and then Angel Jennifer walked in and helped me.
That's when Meg said, "I'm Meg, I know CPR," and I said, "I'm Jen, I can help."
And at that point, we just continued to share in the compressions.
And they just took over. They were so confident that they could come into this awful situation and know what to do and do it effectively. And that is a miracle.
I would say within 5 minutes, you know, we were breaking ribs, and we just decided we were going to keep going. You know, we were going to keep going until EMS got there, and that's what we did.
Justin and I ran outside and hopped in the helicopter, and off we went. And it's only about a 10-minute flight for us. And at this point, from the 911 call, we were over 20 minutes from the initial start of CPR. So we landed in the front yard of this house, and luckily some Good Samaritans had happened to pull up on some ATVs to help us with all of our equipment. Justin and I jumped out with the helicopter still running with all of our emergency equipment, and hopped on the ATVs to get over to the patient.
When we heard the helicopter coming over the hill, I kept thinking, oh goodness, only a few more minutes and then my role will be done. Just knowing that they were there kind of boosted the adrenaline and kept you going, and you just knew that this is almost to the end.
When we arrived on the dock, there were someone was doing CPR, and I said, "We're with alert, please don't stop." When there's only two of you, you use all the hands you can get, and they were doing an excellent job of CPR, so we had them continue.
Rickety old dock. It felt like it was on barrels or something. It wasn't quite solid, and there was an enormous amount of people out on this 4-foot wide dock. Movement around on the dock was challenging. I was in a V-fib rhythm, which was after 20 minutes of early CPR, 25 minutes till we got there. We were all preparing ourselves for the worst.
For approximately 20 minutes, we gave honestly every medication that we carry with us that's appropriate for ventricular fibrillation. We shocked him 4 times and continued the CPR for 20 minutes.
So Bob had been down for 45 minutes without a pulse, without breathing. Studies have shown, and my own personal experience has shown, that this is not looking good.
His daughter was there. I asked if there was family around, and his daughter made herself known.
Joy, asked me if he had an advance directive, and that they had pretty much done everything they could do.
We were going to try one more medication called sodium bicarb, and I was talking to her while I was pulling that medication out of the pack.
We went from, having one of our perfect summer days that we get to have up here to facing the thought that we would never have him again.
They looked at the monitor, and then he had a really weak sinus rhythm. They were ready to call the code, and he said, "Oh no, you don't. Here I am, I'm coming back."
And I went to feel his femoral artery, and I had a pulse. And Justin, my partner, who had been up at the head working on airway and bagging, was very surprised. We loaded the patient in the Lakeside ambulance, and I loaded my pockets with the epinephrine from Lakeside. They graciously gave us everything they had. When we landed, we did what we call a hot offload. We don't shut down the helicopter. We get extra help out there, and we get people in the ER fast, and we gave report to Dr. Bartels.
Joy had these big eyes, a lot of adrenaline still going, and she went through this incredible story with me. So I go about assessing him, and the first thing I noticed, well, he looks pretty stable, you know, that monitor looks pretty good, and he's got a good blood pressure. I'm thinking to myself, you know, this guy doesn't really look quite as dead as I would expect him to be.
I just couldn't believe that, you know, he could survive that much time without significant brain damage.
I remember calling Brett about another case a couple days later and said, oh, by the way, how did Mr. Christensen do, the guy out at Lake Mary Ronan? He said we just warmed him up and he's waking up.
To this day, I consider he's a miracle guy.
We kept talking to him while he was with the tubes in his mouth, and he looked like he was like looking around, and his eyes were going side to side like, where am I? what has happened? We were asking him, do you recognize us? Because that was kind of our first concern, is he going to have any memory whatsoever? Is he going to know who we are? He kind of gave us that look like, of course I know who you are. One day he said to me, I got there in the morning, and he said, these people are telling me that I had a heart attack. He just couldn't believe it.
But the first thing I remember in the hospital was when the helicopter crew came up and visited me. I thought that was nice, but from then on I pretty much got my memory back, and now I'm back to doing whatever I was doing before.
We did put in a defibrillator, which is a protective device that if he went into cardiac arrest again, it would either pace or shock him out of it and protect him from sudden cardiac death.
He is back to his stubborn, ornery self, doing all the things that he loves to do, fish and spend time outside, and he has a second chance, basically, at life, and that doesn't escape any of us. I think he's pretty amazed himself that he's alive today.
I've been doing this 30 years, and you can count on my fingers, probably of one hand, the outcomes I've seen like this.
And he hasn't had any arrhythmias on his defibrillator. We've been checking him every 3 months. He's just been doing wonderfully.
I'm lucky to be here. I guess my number wasn't up, and I was blessed that day that everything happened the way it did.
So just as a side note, the morning when I was getting ready for work, I had found out that I was pregnant. So there must have been something in the air that day for good life aura and karma. There was miracles happening.
A word or two about Jennifer and Megan for stepping up and doing that CPR, and it was so important that if it wasn't for them, I wouldn't be around. And the helicopter crew too, they worked on me for 25 minutes and never gave up, and then they got me to the hospital in time for them to work on me.
The two ladies that performed the CPR for 20 to 25 minutes before we got there was, and I told them this, that it was phenomenal. It was, Bob wouldn't be around today if it wouldn't have been for those two young ladies.
It's really a courageous thing, what they did.
I'm going to be the #1 person that learns how to do it too, because I got a lot of paying back to do.
They saved his life, no doubt.